All right, Weight and Gold community, we are talking about medications used for weight. I'm Dr. Leslie Golden of Weight and Gold Wellness, and you're watching the Weight and Gold YouTube channel. So like, subscribe, because you don't want to miss this as we're going to go through all of these different popular medications. And I took a lot of time, not really, probably about a couple minutes, just trying to decide where do I even start? Which med do I want to start on? And I really think, there's so much talking about all these GLP-1s and nutrient stimulating hormones. And we're not going to start there because I think we're going to start with one of the oldest medications that has been used for weight for a long time. And that's Phentermine, right? And so Phentermine's gotten a bad rap. I remember I used to be a provider myself too that would say, I don't prescribe that medicine. And I think there's just a lot out there that's misunderstood about it. And I think it also just goes along with a lot of weight discrimination and weight bias with this understanding of you don't need help. You shouldn't need help. You should just try harder. And this is just a short-term situation. And you can take this medication, but only for a short time, because from that point on, you should be able to manage this all on your own. And a lot of these really outdated approaches that I hope that we'll be able to break down through here. Now, as I said in the intro video, this is not medical advice. These medications are not appropriate for everybody as we discuss them. I'm not necessarily saying that you personally should start this medication. That needs to be decided between you and a trusted, trained healthcare provider within the obesity medicine field, preferably. So when we look at Phentermine, so Phentermine is a sympathomimeticamine. It's been around since the 50s, yes, as in like the 1950s, back before the FDA really even did clinical trials in the way that we know it today. So there hasn't actually been clinical trials that I'm aware of on generic Phentermine. So a lot of the information that we use when we're making decisions about using Phentermine is information from the trials from 2014. I think they were completed in 2014 on the trademark drug Qsymia. So this is a drug that is half Phentermine and half topiramate, which is another generic drug that we use for treating obesity. And it has been approved for long-term, because this is a chronic disease, treatment of obesity, preferably for like someone that has what we call like the hungry brain type phenotype of obesity, but it can work well for many people. So we know from that FDA trial that the Phentermine component of that medication seems to be safe long-term. It has now been approved for use in adults and children that meet the criteria and don't have contraindications to the medication, right? Because in every medication and really in every treatment approach that we use, we're always weighing the risk-benefit situation, right? Everything in life has some type of side effects, and that's what we have to manage and consider. So none of these medications are right for every person, but they can be life-saving for the right person. So when we look at Phentermine, we've been using it for 70 years, right? Close to 70 years. And it is a sympathomimeticamine, which means it's stimulant-like. It is a controlled substance, but not at the level of some of the other controlled substances that we're used to, because despite what people think of it, it has not been shown to create any type of withdrawal. There isn't any evidence of misuse of it. And it doesn't seem like people don't necessarily get dependent or addicted to it, right? So it can be very beneficial for patients. And it helps by reducing appetite, but that's what most people experience. And it can increase your body's metabolic rate, right? The amount of energy that your body burns. So in the obesity medicine world, we look at it as, well, it activates like the anorexigenic pathway. So the pathway out of the brain that tells the body, yes, we should be trying to lose weight. Without getting too sciencey, that's the best way I can describe it. It does come in a pill form. It's usually not covered by insurance, and it's usually pretty affordable, even if an insurance company doesn't cover it. So some reasons this may not be appropriate for someone, if someone has a history of irregular heart rhythm, because it could make that worse. If someone has active heart disease, because we haven't tested it in those individuals. If someone has uncontrolled, really, anxiety or very uncontrolled high blood pressure, or if someone has hyper as an overactive thyroidism. There's also some of our psychiatric health concerns where if someone has uncontrolled bipolar, that may be another situation where someone's not the best fit for this medication. So when someone's blood pressure is controlled, or if their hyperthyroidism was in the past and is now stable, that doesn't necessarily mean that someone cannot use this medication. So we often see with side effect profile with Phentermine, since it can be stimulant-like, it can be activating, right? So some people will notice like an increase in energy, an increase in intention, an increase in concentration. If you take it too late in the day, it could interfere with how well you get rest at night, and it can make you very thirsty. We hear that from a lot of people. And to be honest, most people just need to drink that much water. A lot of us aren't drinking the amount of water that we need. Some people, if they're very sensitive to these medications, may feel like their heart is racing. It can make people feel like they're more anxious. And that's why it's an individual discussion of, is this medication working for you? Is it causing distress? Because we don't want to impair someone's quality of life just to reduce the number on the scale, right? We always want to make sure this is beneficial. And reducing the number on the scale shouldn't be our main priority at all. Anyway, we are always counseling patients on this. We're trying to reduce our adipose tissue, but we do not do any of that at the expense of compromising someone's mental health. So as we look at side effects, possible risks, indications for the medicine, we talked at the beginning, the indication for any of, in our first episode, the indication for the use of any of these medications is usually a BMI of 27 with weight-related conditions, or a BMI of 30 without any weight-related conditions. However, there are some exceptions to that based on ethnicity, history, body composition, etc. Again, the importance of finding a very experienced and knowledgeable obesity medicine provider to work with you on these things. So why do so many people have concerns about Phentermine? Water. There's this misunderstanding that maybe it's like fen-phen. So there is this drug, the drug combination with phenfluramine that caused pulmonary hypertension and valvular disorders in some individuals that had used it, and it was taken off the market, I think back in the 90s. So Phentermine is not the same as that drug. It was studied in what we call a retrospective study. I believe we call it the Lewis study, that was released maybe in 2013. You'll have to check those dates for me, where they looked at like nearly 14,000 patients that had been on Phentermine for years, and looked back at their course and how their health changed. And it was really reassuring that in this study, they were able to see that there was no increase in cardiac events, no increase in blood pressure, no increase in heart rate. So it's really just another example of being able to see that because Phentermine, when it does actually cause weight reduction for an individual, because of the benefits of that weight reduction, we're actually not seeing concerns that people have of like raising your blood pressure, raising your heart rate, and we haven't seen cardiac events related to it. We do know that having uncontrolled obesity leads to risks of heart disease, atrial fibrillation, etc., high blood pressure. So that's, again, when we look at we can't look at these separately. We have to look at the risk benefit situation. If I'm someone that is carrying more adipose tissue than is healthful for my body, and I'm at risk for developing heart disease and high blood pressure and atrial fibrillation and sleep apnea and all these other things later in life, well, is the risk of taking phentermine long term really more than the risk of treating obesity? And I would say no. Especially with what I've seen, the research just doesn't support that this medication is more of a risk than not treating the disease itself, unless you have those specific contraindications. So what kind of weight loss do we see with phentermine? It really varies. Like I always remind people, we have people that are hyper responders to these medications, and we have people that they don't necessarily respond. And a lot of that is related to there are different types of obesity. Some of us have obesity related to our coping skills and emotional eating. Some of us have dysregulation of the hormones from our gut. Some of us really may have this lack of communication and signaling from our brain where phentermine could be very helpful for. So it really just depends on the individual. But in general, I would say see patients achieve somewhere between 10 and 12% weight reduction with phentermine, over a 6-month time period. So just another option to consider. Again, the key points for phentermine is it does seem to be safe for the right person. It is cheap. Access to it is not a concern right now. And it's been used for nearly 70 years. It's one of our oldest drugs. So for individuals that really are concerned about the length of time and how long something has been tested on the market, this is a medication that is still a very good option for the right patient. And once you're on it, we do encourage people to be on it long term. It is a medicine that we definitely see patients as they come off of, the weight just comes right back up. And that's not a willpower issue. That's really your disease is just not controlled anymore. Your metabolic rate may drop. The cues to your brain of how hungry you are will probably go back to your pre-controlled state. And when I tell patients all the time, when your brain is telling you all day long these messages, go eat something, we haven't had enough, that wasn't enough at lunch, when do we get to eat again? When all of that is flooding your brain, it is not as simple as telling someone like, oh, just get it together and have more willpower and stick to your diet for the rest of your life. That's not a reasonable medical recommendation or treatment plan. So if these medications are something that you need to stay on, that's okay, just like any other chronic condition. And hopefully you're working with a provider that can give you that level of support. So I hope this has been helpful as we talk about phentermine, and follow along as we'll keep covering additional medications each week. Take care.